Have you ever woken up feeling off? Maybe your head throbs, your chest feels tight, or a strange fatigue clings to you like fog. Most of us brush these sensations aside, chalking them up to poor sleep or stress. But what if these morning symptoms were more than just a rough start to your day? What if they were silent alarms your body was desperately trying to ring? In this video, we're going to uncover 5 crucial signs that may appear first thing in the morning. Signs that could indicate something far more serious: cancer. Don't skip ahead. Don't click away. Because recognizing these signs early could very well be what saves your life or the life of someone you love. Before we dive into these vital warning signals, take a moment to support this mission of spreading life-saving health knowledge. Click the like button, share this video with friends and family, and if you haven't yet, hit that subscribe button and tap the notification bell so you never miss an important update. If this video speaks to you, comment 1 below. If not, comment 0. Your feedback matters and helps us improve. Now, let's begin. If you or someone you know over the age of 60 has recently started experiencing any of these 5 morning symptoms, don't wait. Get checked immediately. Because when it comes to cancer, time isn't just precious, it's everything. Dear friends, cancer has become one of the deadliest health threats, not just in Vietnam, but across the globe. It's often referred to as a silent killer creeping in unnoticed until it's too late. Many associate a cancer diagnosis with hopelessness, a storm that hits without warning and leaves destruction in its wake. But there's another side to this story, one that offers hope. Doctors and cancer experts around the world agree if cancer is detected early, it can be treated, sometimes even completely cured. And early detection begins with recognizing symptoms, no matter how subtle, no matter how ordinary they may seem. Let me take you to a small rural village in Vinh Phuc, late 2022. A man named Mr. Tan Tong woke up every day for 2 weeks, gripped by unbearable chest pain and violent coughing fits that lasted over 30 minutes. He thought it was just a seasonal flu, or perhaps a lingering cold. But something didn't feel right. Trusting his instincts, he went to Vinh Phuc Provincial Hospital. Their imaging revealed something no one wants to hear: a tumor in the center of his right lung. Still not convinced, he sought second opinions from both Bach Mai Hospital and Military Medical University 108. The diagnosis was confirmed: lung cancer. Can you imagine that moment? The fear, the disbelief, the cascade of questions. Yet amidst the terror, there was a sliver of light. The doctors told him it was still in the early stages. Fast forward to November 2023, after 3 rounds of radiation therapy and consistent follow-up treatment, Mr. Tan's condition drastically improved. His cancer was nearly eradicated, all because he didn't ignore his symptoms. This story isn't just about one man. It's a lesson for all of us. Early recognition saves lives. So let's go through these 5 alarming signs that you must never ignore, especially if they greet you first thing in the morning. Number 1, persistent headaches. After waking up with a pounding head might feel like a nuisance, but it can sometimes be much more than that. If you're constantly greeted by headaches every morning, don't dismiss them. A headache upon waking could indicate underlying cerebrovascular disease, a condition where blood flow to the brain is restricted. When your brain doesn't receive enough oxygen and nutrients, the result is often fatigue, foggy thinking, and yes, persistent headaches. But that's not all. You might also experience dizziness, restlessness, difficulty sleeping, daytime drowsiness, balance problems, and memory lapses. Left untreated, cerebrovascular issues can progress to strokes, coma, or even death. Another potential cause: cervical spondylosis, a degenerative condition where bony spurs grow on the neck vertebrae, pressing against nerves and blood vessels. This impedes blood flow to the brain, causing headaches, nausea, blurred vision, and difficulty concentrating. Mental health, too, can be a hidden culprit. Depression and anxiety disorders can manifest as chronic morning headaches. This is often due to low serotonin levels and elevated cortisol, the body's stress hormone. So, what can you do first? Don't delay. See your doctor for a full evaluation. If your symptoms are mild, here are 3 natural methods to relieve morning headaches. Ginger tea. A teaspoon of freshly grated ginger in hot water can reduce inflammation and ease pain naturally. Sip it slowly while it's warm. 2. Hot foot soak. Immerse your feet in warm water for 10 to 15 minutes. This helps dilate blood vessels, improve circulation, and relax tension. 3. Breathing exercises. Deep controlled breathing, first thing in the morning, can reduce cortisol levels and help calm the nervous system. Morning headaches aren't just an inconvenience. They could be an early clue your body is trying to warn you. Pay attention, because sometimes small symptoms hide the biggest dangers. Number 2. Persistent joint pain that doesn't go away. We all expect some aches and pains as we get older. Little stiffness in the morning knees that complain when we go upstairs, or fingers that don't move quite like they used to. But what happens when that discomfort lingers and grows? When the pain isn't just a passing annoyance, but a daily companion, sharp, deep, and unrelenting. For people over 60, chronic joint pain is often chalked up to aging or arthritis. But in some cases, it may be something much more serious, something quietly growing beneath the surface. Because persistent joint pain, especially when it shows up suddenly or worsens rapidly, can sometimes be an early sign of cancer. Cancers like leukemia, bone cancer, and even lung or breast cancer that has metastasized to the bones can cause ongoing joint pain. And unlike typical arthritis, this pain might not improve with rest. It might wake you at night gnawing deep inside your bones. It might move from one joint to another, and it may be accompanied by swelling tenderness or even unexplained bruising. Let's take leukemia, for example. This cancer affects the blood and bone marrow, but one of its hidden symptoms can be bone and joint pain, especially in the long bones of the arms and legs. It's not just discomfort, it's a pressure from within as abnormal cells accumulate and crowd out the healthy ones. Or consider bone metastasis, when cancer spreads to the skeleton. It can cause pain in the hips, back ribs, or shoulders areas we often attribute to simple overuse. But the difference lies in the quality of pain. Cancer-related joint pain tends to be more persistent, more intense, and less responsive to conventional pain relief. Even more subtle is the way some people start to move less, not because they're lazy or tired, but because the discomfort gradually limits their daily routine. They stop gardening, walking, or reaching for things on high shelves. Over time, this shrinking of movement isn't just a loss of mobility. It can be a red flag, waving silently. And here's where it gets even more dangerous. Many people delay seeing a doctor because they assume the pain is normal, or they mask it with over-the-counter pain relievers, unknowingly delaying a diagnosis that could save their life. This is especially true for older adults who may already have arthritis or osteoporosis conditions that can disguise cancer's warning signs. So how do you tell the difference between normal joint pain and something more sinister? Watch for pain that persists for weeks or months without improvement, worsens over time instead of staying the same. Comes with other symptoms like fatigue, fever, weight loss, or night sweats. Happens in unusual places or moves from joint to joint unpredictably. Is unresponsive to medications or physical therapy. And remember, cancer pain often doesn't behave like typical wear and tear pain. It has a rhythm of its own. It may come at night. It may feel deeper, more internal. And it may be accompanied by sensations that just feel off, even if you can't quite explain why. If any of this sounds familiar to you or someone you love, don't brush it off. Your joints could be telling you something urgent. The body often speaks in whispers before it screams, and in the case of cancer, early detection is the single most powerful tool we have. So if you find yourself reaching for pain relievers more often, if you've stopped doing the things you love because of pain, or if your joints seem to ache in ways they never used to, it's time to ask questions. Not just for comfort, but for your health and your future. Number 3, a loss of appetite after waking up. Previously, we talked about joint pain that lingers as a potential early warning sign. But what if the signals are even quieter, like simply not wanting to eat in the morning? Losing your appetite first thing after waking up might seem harmless at first. Maybe you just don't feel like breakfast. Maybe you tell yourself it's stress age or just not being a morning person. But when this becomes a frequent pattern, it could be your body's way of whispering that something is wrong. Loss of appetite in the morning can seriously impact your eating habits and, over time, your overall health. And this isn't just about skipping one meal. It's about what that absence of hunger might be pointing to underneath. There are many reasons why this could happen. Some are relatively simple, while others may be early signs of more serious health issues. For instance, gastric ulcers are a common culprit. When the protective lining of the stomach becomes damaged by acid, it can lead to discomfort, nausea, and a reduced desire to eat, especially in the morning. The pain or bloating from an ulcer often becomes most noticeable on an empty stomach, which might explain why your appetite vanishes upon waking. Then there's fatty liver disease, another silent condition that's been increasingly common in adults. When the liver becomes overloaded with fat, it can disrupt digestion, leading to general discomfort and reduced appetite. You might not notice any sharp pain, but a constant feeling of fullness or sluggish digestion can slowly push your eating habits off track. More concerning, though, is when cancer lies at the root of this change. Cancers, particularly of the stomach or esophagus, can directly interfere with your body's ability to process food, triggering a persistent lack of hunger. And while this kind of loss of appetite might start subtly over time, it may be joined by other symptoms, weight loss, fatigue, or difficulty swallowing. These symptoms often creep in quietly, making early detection even more important. So, how do you know when to worry? If you consistently wake up without an appetite, especially if it's paired with other changes in your health or lasts for more than a week or two, don't ignore it. Your body could be trying to get your attention softly but urgently. If this issue is mild, there are a few simple techniques that may help reignite your hunger in the morning. 1. Eat a light breakfast. Start with something small but appealing. Healthy snacks like fresh fruit, a handful of nuts, or a cup of yogurt can help stimulate appetite without overwhelming your system. The key is to ease your body into eating, not force it, too. Drink fresh fruit juice. A glass of freshly squeezed juice not only provides important vitamins and minerals, but can also awaken your digestive system. Citrus fruits like orange or grapefruit are particularly effective, offering a refreshing boost that often jumpstarts the appetite. 3. Try stimulating flavors. Incorporating foods with bold flavors like herbs, spices, or mildly spicy dishes can help reawaken your taste buds. Aromatic ingredients such as ginger mint or cinnamon may trigger a sensory response that encourages you to eat. Sometimes even the aroma of a favorite dish can help coax your body back into wanting nourishment. Think of it like warming up an engine. You don't floor the gas pedal first thing you ease it in. But remember, if your loss of appetite persists, don't rely on home remedies alone. Appetite is a basic signal of well-being. When it fades without clear reason, especially upon waking, it could be the first domino in a line of more serious health issues. So ask yourself, is your lack of hunger just a passing mood, or is it a message your body's been trying to send for weeks? Number 4, waking up with a bitter taste in your mouth. Have you ever woken up after what should have been a restful night's sleep, only to find your mouth dry and coated with an unmistakably bitter taste? That lingering bitterness, often accompanied by fatigue and discomfort, can sour your entire morning before it even begins. For many older adults, this may seem like a harmless annoyance, but in truth, it could be your body whispering about something deeper. Most people quickly blame it on everyday stress, late nights, irregular routines, too much work, or even a long-standing smoking habit. And while these factors can certainly play a part, waking up with a bitter mouth isn't always about lifestyle. Sometimes it's a red flag for something going on inside. Let's break it down. 1. The liver's silent cry for help. In both modern and traditional medicine, the liver is seen as a master regulator. It's responsible for detoxifying the blood, supporting digestion, and maintaining the smooth flow of energy throughout the body. But when the liver is overburdened, whether by alcohol, stress, poor sleep, or chronic illness, it can't function efficiently. In traditional Chinese medicine, TCM, this leads to what's called liver heat, or liver qi stagnation. When this internal heat builds up, it affects the gallbladder and causes an overflow of bile into the stomach or mouth, resulting in that unmistakable bitterness upon waking. People under chronic pressure, those who are quick to anger or who live with constant fatigue, may be especially at risk. Over time, the liver's diminished function doesn't just cause a bitter mouth. It may also lead to acid reflux, a thick coating on the tongue, and digestive discomfort. 2. Acid reflux. The stomach's backflow alarm. When the valve between your stomach and esophagus, called the lower esophageal sphincter, becomes weak, often due to age, obesity, or poor eating habits, it allows stomach acid to flow back upward. This backward splash doesn't just bring a burning feeling to your chest. It can travel all the way to the mouth, leaving behind a sour, metallic, or bitter flavor that's especially noticeable first thing in the morning. If you notice this after lying down or after a heavy late night meal, acid reflux could be the cause. 3. The kidneys. Filters in trouble, the kidneys, which quietly filter waste from the blood and control fluid balance, play a critical role in how clean your internal environment stays. But when kidney function begins to decline, toxins can build up in the bloodstream. This toxin overload doesn't just stay hidden inside, it begins to show up in subtle but serious ways. Dry skin, persistent bad breath, a metallic or bitter taste in the mouth, and yes, dryness upon waking. If this is paired with other symptoms like swelling, high blood pressure, or fatigue, it's time to take it seriously. 4. Diabetes and medication side effects. Bitter morning breath and dryness in the mouth can also be linked to diabetes, especially if blood sugar levels are poorly controlled overnight. Certain diabetes medications may contribute to dehydration or trigger taste changes, making that bitterness even more pronounced. If you're managing diabetes and notice this symptom regularly, it may be worth discussing your medications and glucose control strategy with your doctor. Now, don't forget oral hygiene. Sometimes the answer is simpler. Your mouth itself may be the source. Poor oral hygiene, gum disease, or even sleeping with your mouth open can lead to bacterial buildup overnight, producing a foul or bitter taste in the morning. Make sure you're brushing correctly, using gentle vertical strokes from the gums toward the center for at least 2 to 3 minutes each session. Don't scrub aggressively or brush side to side as this can damage your enamel and gums. And if you wear dentures or have dental appliances, clean them thoroughly each night. What you can do today, if this bitter taste in the morning keeps showing up, don't ignore it. Start by taking a good look at your daily habits. Are you sleeping enough? Are you managing stress, eating clean, and staying hydrated? If it's liver related, learn to manage anger and emotional stress. Support liver health by eating lighter meals and reducing alcohol intake. If it's reflux, avoid spicy, greasy, and acidic foods before bed. Sleep with your upper body slightly elevated. If it's kidney related, monitor your blood pressure and stay hydrated but not excessively. Watch for other signs of kidney distress. If it's diabetes, work with your doctor to regulate your sugar levels and monitor how your body responds to medication. If it's dental, improve your brushing technique and consider using a tongue scraper to reduce buildup. And if you're still with me, thank you. Comment number 2 below if this part resonated with you so I know you're still watching and learning. Most importantly, listen to your body. If the bitter taste comes with other symptoms like bloating, abdominal pain, unexplained weight loss, fever, or constant fatigue, don't wait. See a doctor. The earlier you catch a problem, the easier it is to treat and the better your quality of life will be. Number 5, persistent coughing after waking up, a warning sign you shouldn't ignore. In the previous section, we explored how waking up with a bitter taste in your mouth could be a subtle indicator of deeper internal imbalances. Now we move on to another common but often overlooked morning symptom, persistent coughing after waking up and what it could mean for your health. Have you noticed yourself or a loved one waking up every morning with a nagging dry cough? One that doesn't go away in a few days or even weeks. Many people dismiss this as something minor, perhaps just a side effect of dry air allergies or a sore throat. But what if it's not that simple? In fact, a persistent morning cough could be one of the earliest and most crucial signs of something far more serious: lung cancer. Lung cancer, the silent killer that starts with a cough. Lung cancer remains one of the deadliest diseases globally, claiming countless lives each year. What makes it especially dangerous is that it often develops silently, without dramatic or obvious symptoms in the beginning. By the time most people are diagnosed, the disease has already progressed to an advanced stage, making treatment much more difficult. One of the earliest warning signs of persistent, unexplained cough, especially first thing in the morning. According to medical research, over 90% of patients diagnosed with early-stage lung cancer experienced a form of chronic coughing. At first, the cough might not seem severe. There's usually no fever, no extreme fatigue, and no coughing up blood. But it continues for weeks. The cough is often dry and irritating. Some patients might feel throat discomfort, mild chest tightness, or difficulty breathing without any clear cause, like a cold or flu. You might also experience occasional wheezing or a sensation that swallowing has become harder than usual. When should you be concerned? Here's a general guideline. If your cough lasts longer than 2 weeks, especially if it worsens in the morning and doesn't seem to respond to regular cold or allergy treatments, it's time to be alert. Are you someone with a history of smoking or have been exposed to secondhand smoke or polluted environments over the years? These factors greatly increase your risk of developing lung-related conditions, including cancer. Even if you're not in a high-risk group, don't ignore a persistent morning cough. It could be a red flag from your lungs trying to get your attention before things get worse. Other possible causes of persistent coughing. To be fair, not every case of morning coughing points to lung cancer. Several other respiratory conditions can also produce this symptom: pneumonia. Especially in elderly individuals, this infection can cause lingering cough fatigue and chest discomfort. Bronchitis. Both acute and chronic bronchitis can lead to prolonged coughing spells, particularly in the morning. Asthma. Early morning coughing is a hallmark of asthma, often paired with wheezing and breathlessness. Tuberculosis TB. This infectious disease may begin with a dry cough that becomes more intense over time. Empyema or pleuritis both involve inflammation or infection in the chest cavity, which may present as coughing and chest pain. The key takeaway: persistent coughing is a symptom, not a disease in itself. Identifying the cause early, through proper medical evaluation, is vital for protecting your long-term health. So, what should you do if you've been experiencing persistent morning coughing for more than 2 weeks? Especially without an obvious cause, don't wait it out. Make an appointment with your healthcare provider and request a comprehensive health checkup, including a chest x-ray or lung scan if necessary. Early detection of lung cancer significantly improves treatment success rates. The sooner a problem is found, the more options you have to manage or even overcome it. Simple morning habits to support lung and overall health. While you're seeking professional help for chronic coughing, you can also adopt some positive morning routines to protect your respiratory system and overall health. Warm up your body. Before stepping out of bed, before rushing into your day, take a moment to stretch gently, move your limbs, and warm up your body. This helps activate circulation and prepare your organs, including the lungs, for the day ahead. 2. Drink a glass of warm water. Hydrating first thing in the morning is a powerful way to clear mucus, support the immune system, and flush out toxins. Warm water's especially effective. It soothes the throat, improves metabolism, and even reduces the risk of kidney stones and digestive issues. 3. Perform gentle stretching exercises. Stretching helps release tension, improve oxygen flow, and stimulate the lungs and diaphragm. It's a great way to shake off stiffness from the night and improve your breathing capacity. 4. Establish a regular bowel movement routine. Believe it or not, regular bowel movements can have a surprising effect on respiratory health. When digestion is efficient and waste is cleared daily, your entire body functions better, including your lungs. Are you still with me? If you're still watching and found this part valuable, comment number 3 below, so I know you're continuing this health journey with me. Your time and attention mean a lot. Thank you. And remember, coughing is not always just a minor irritation. In some cases, it may be the first sign your body gives you a quiet warning before something serious. Listen to it. Take action early. And now, we arrive at the end, but really this is just the beginning, because everything we've talked about today isn't meant to scare you. It's meant to awaken you. These 5 signs may seem small or harmless at first. A little weight loss here, a bit of fatigue there, a subtle change in your skin. But for those of us over 60, these changes are like the soft tapping of rain before the storm. If we listen closely, we can act before the lightning strikes. Cancer doesn't always arrive with blaring alarms. It often tiptoes into our lives wearing the disguise of normal aging. That's why awareness isn't optional, it's life-saving. Your body speaks. It always has. But now more than ever, it's whispering truths you can't afford to ignore. Maybe you've noticed some of these signs. Maybe you brushed them off. But today you know better. And knowledge is the first step toward action. So here's what we ask of you. Don't wait. Don't wonder. Talk to your doctor. Schedule a checkup. Reconnect with your body like you would with an old friend who's been trying to get your attention. And if this video gave you even one moment of clarity, don't keep it to yourself. Share it with a friend, a sibling, a parent, someone you care about. You never know whose life you might save just by starting the conversation. Tell us in the comments, which of these 5 signs surprised you the most? Your experience might be exactly what someone else needs to hear. If you found this video helpful, give it a thumbs up, subscribe to our channel, and hit the bell so you never miss a vital health update. Because growing older doesn't mean growing weaker. It means getting wiser, stronger, and staying ahead. Thank you for being here. Stay safe, stay curious, and we'll see you in the next video.